Hi, my name is Derek, and I'll be explaining the steps needed to be taken to carry out a successful assessment of the heart. First, the patient should be asked if he or she has experienced any chest pain, shortness of breath, heart palpitations, blackouts, strokes, or any other cardiovascular problems in the past. Then begins the assessment of the internal jugular vein to see if there is any distension. First, the patient should lie down on the exam table and have their head turned to the left, exposing their sternocleidomastoid. If a pulsation is seen, first make sure it is not a pulse from the carotid artery by making sure it does not coincide with the radial pulse. Then check if the distension goes away when compressed. If not, compare it to the angle of Louis. If the distance from the pulsation to the angle is from 2 to 4 centimeters long, the patient is fine. But if the pulsation is further away, this could indicate right-sided heart failure, constructive pericarditis, or tricuspid stenosis. Next, we will listen to the heart valves to see if they sound normal. A normal sounding heart will make two noises when beating. These two noises, called S1 and S2, are a result of the heart valves closing. A normal heart will sound like, whereas an abnormal heart might have sounds other than S1 and S2, called S3 and S4. S3 being an indication of left ventricular failure, while S4 could be linked to blood trying to enter a stiff left ventricle during atrial contraction. While listening to the heart, look for murmurs, which are odd cooing and whooshing sounds that could indicate valve defects. Lastly, it's time to palpate the chest and find the point of maximum impulse. To do this, place the palm of your right hand across the patient's left chest, with your fingers extending below the nipple. Feel for the point of maximum impulse, which is usually near the apex of the heart. A normal-sized impulse will generate a penny-sized pulse. You should feel for the duration and the vigorousness of the impulse, which could indicate hypertension and valve defects. And that ends the procedure of how to assess the heart.